How genetics can play a big part in hypertension and diabetes?
Both are very much genetically modulated disease. Parents are diabetic, then subject will suffer from diabetes in most of the situation. If both parents are hypertensive, then 90% of the subjects will suffer from hypertension.
How sleep cycle pattern and lifestyle pattern can cause diabetes and high blood pressure?
Inadequate sleep for months together may predispose to hypertension and diabetes. Alteration of sleep rhythm, which is common in nowadays those who work from home or work from some other country, those who have night shift, they predispose to hypertension. So we are seeing hypertension and diabetes much earlier than before.
How someone can control their blood glucose or hypertension by maintaining a lifestyle? What kind of lifestyle they should follow?
To have good blood pressure control, patient have to follow a good lifestyle. Regular physical exercise, that is more or less 5 kilometer walking 5 days in a week. BMI have to maintain, and better is BMI around 22 or 23.
Hello and welcome to the newest episode of Heart Talks. I'm Tanaya, your host, and today we have a very special guest with us, Dr. Salil Kumar Pal. Welcome, doctor, to our show.
Thank you.
So, doctor,
Good morning.
Today we are going to talk about hypertension and diabetes mostly. So, what are the early signs that people tend to ignore in hypertension and diabetes?
Very interesting question. See, diabetes and hypertension both are more or less silent disease. That is, they are mostly asymptomatic. If the diabetes is very much full blown, then it may present with polyuria, polydipsia, and polyphagia. That is, increased urination, increased thirst, and hyperphagia. That means excessive intake of food. But type 2 diabetes is mostly asymptomatic, and without going through the blood investigation, it is very difficult to diagnose. But in some situation, type 2 diabetes may present with symptoms like frequent change of refraction, furunculosis, genital infection, or peripheral neuropathy, that is tingling and numbness of the limbs. And hypertension is again mostly asymptomatic, that is, they usually do not present with symptoms. But if the hypertension is very serious or very severe type, then it may present with headache in the occipital region, that is back headache, excessive palpitation, or respiratory distress may be symptoms of hypertension. But again, for diagnosis of hypertension, you have to meet your physician.
So, doctor, my next question is how genetics can play a big part in hypertension and diabetes?
Again, a very interesting question. Hypertension and diabetes both are very much genetically modulated disease. That is, hypertension and diabetes runs in families. If the parents are diabetic, then subject will suffer from diabetes in most of the situation. And again, if the mother or father is hypertensive, or if both parents are hypertensive, then 90% of the subjects will suffer from hypertension. So both these two disorders are very much genetic disorder. Okay.
So, doctor, my next question is how sleep cycle pattern and lifestyle pattern can cause diabetes and high blood pressure?
Sleep cycle pattern and duration of sleep are very much related to diabetes and hypertension. Both are lifestyle disorder. And inadequate sleep for months together may predispose to hypertension and diabetes. And alteration of sleep rhythm, which is common in nowadays, those who work in work from home or work from some other country, those who have night shift, or continuous alteration of sleep rhythm, they predispose to hypertension. So we are seeing hypertension and diabetes much earlier than before. We are seeing that young subjects uh, doing jobs suffer from hypertension and diabetes more frequently, and their blood pressure and sugar is most of the situation is difficult to control.
So, doctor, my next question is very important. That is, how can someone monitor their diabetes and hypertension at home?
Very good question, really. In fact, hypertension and diabetes are two chronic disorders. That is, it is not like infection that you take antibiotic for 7 days and it will be cured. It is a lifelong disorder. So patients have to monitor their blood pressure and hypertension. And if the subject is well conversant with the measuring how to measure blood pressure or how to monitor blood sugar, then it will be very helpful to him. So, for hypertension, home blood pressure machines, which is nowadays very much easily available and not that costly, helps in the patient for monitoring blood pressure. In fact, we give much more importance than home blood pressure measurement than office blood pressure measurement. As because in office measurement, there may be stress and strain, there may be increase of the blood pressure due to uh, waiting in the outpatient department, or there may be stress uh, of previous day, less sleep, or any anxiety. So that there may be increase of blood pressure in the office measurement. But home blood pressure measurement is much more important, and patient have to purchase a good blood pressure measurement machine. For blood sugar measurement, uh, patient if the patient is on insulin, then frequent blood sugar measurement is essential. But if the patient is on oral antihypoglycemic drugs, then blood sugar measurement is required, but not that frequently. But any diabetic patient should know how to measure blood sugar. And if the patient is of gestational diabetes, then 3 or 4 times blood sugar measurement at least in a day is very important. And patient who have good control of blood sugar, he have to measure hemoglobin A1C at least 6 month interval. And if his or her sugar is not well under control, then 3 months interval hemoglobin A1C from laboratory is also important. So measuring blood pressure and control of blood glucose is very important.
So, doctor, how someone can control their blood glucose or hypertension by maintaining a lifestyle? What kind of lifestyle they should follow?
See, hypertension and diabetes as well as obesity, these three diseases are lifestyle disorder. By that I mean that they occur in patients who has bad lifestyle. That is sedentary lifestyle, eating of too much fast food, inadequate sleep, or not taking of regular physical exercise, or uh, their dependency on smoking and alcohol. So, to have good blood pressure control, patients have to follow a good lifestyle. That is, patients have to take good food, less salt intake, then regular physical exercise, that is more or less 5 kilometer walking 5 days in a week, avoid smoking and alcohol altogether, and to keep the uh, body weight in the range, that is BMI have to maintain, and better is BMI around 22 or 23, that is body mass index. So, and he have to take good amount of protein in his food and fresh vegetables and fruits in his vegetables, including milk or any other form of protein.
So, doctor, my next question is how someone can, what kind of self test or screening can one person go through high blood pressure or diabetes?
For hypertension, we have to see whether there is any end organ damage. That is, whether the hypertension is affecting the heart, kidney, or retina. For that, we have to go for ECG as well as echo. For retina, fundus examination by ophthalmologist, and for kidney, creatinine as well as ACR, that is albumin creatinine ratio. These are important for both hypertension as well as diabetes. And for diabetes, apart from all these four, we have to go for estimation of hemoglobin A1C at least 6-month interval, lipid profile at least 1 year interval, and patient sodium, potassium in the patient, especially in elderly subjects. So these are the usual screening, usual test to see whether the patient have good blood pressure control or diabetes control, apart from a regular examination of the blood pressure for hypertension.
What consequences can happen if someone stop taking their medications in high BP and sugar?
So say these two diseases, very dreaded chronic diseases, which are famous for their complications. Hypertension gives rise to very serious complications like cerebrovascular accidents, that is brain stroke, or acute myocardial infarction, that is heart attack. And chronically, hypertension may also affect the kidney, causing chronic renal failure. So these are the usual complications of uncontrolled hypertension. Apart from that, patient may have altered sensorium, that is called hypertensive emergency, and may have visual disturbances that secondary to hypertensive retinopathy. And diabetes is again a very notorious disease, famous for its complications. Diabetes in fact affect all the organ system of our body, starting from eyes to foot. So in the eye there may be diabetic retinopathy and blindness. Cataract is also more common in diabetes. Second, diabetes may affect the kidney. Diabetic nephropathy nowadays is the commonest indication of dialysis, that is, or renal transplant, as you know. And it may also the leading cause of diabetic neuropathy, tingling, numbness of the feet. Diabetes is also the commonest comorbid condition in acute myocardial infarction and peripheral vascular disease and cerebrovascular accidents. So most of the organ system is affected by diabetes, and if the hypertension is there with diabetes, then all the complications starts early and it becomes more dreaded. So all patients after diagnosis of diabetes or hypertension, they have to measure their blood pressure, monitor their diabetes control, so that complications can be avoided and patient may have a good life. If the diabetes or hypertension is controlled, then complications will be avoided, not altogether, but it can be delayed.
Thank you so much, doctor, for your advice. We'll see you all in the next episode very soon. Till then, stay in touch with your doctor and stay hearty and stay healthy. Thank you.